using graphs and other visual tools to help you understand your patient's progress is a really easy way to make sure that things are going in the right track. And in Medesk, there are many ways in which you can analyze the progress of your patients and understand exactly what's going on, whether that's for things like tracking someone's perhaps their weight, their BMI, blood pressure, things like that, especially if they're on certain medications. You will see that in Medesk, what we can do in order to facilitate all this for you is we can first of all make a template that will allow you to understand which parameters you want to actually record. So we're going to look today at waist circumference and weight. And what this is going to do is help you understand how you can actually put this together. So when we're making a template, we are choosing our various different parameters. So take weight. When we are creating this, of course, we name it weight. And we decide that the units of measurement are going to be kilos, grams, and our increments are going to be perhaps 0.5 of a kilo. And the same with waist circumference, really, except we're going to, of course, choose centimeters. Perhaps we'll stick with whole centimeters. Once we have this in place, what we can then do is we can go to our consultations. We'll obviously take the measurements from the patients and we can record them. So I'm going to do a quick cheat, if you will, and I'm going to go straight to previous medical history in here. And you can see one that I prepared earlier where I have some values, which I merely entered in by simply putting the value in and then saving my work. Once you've done this for several visits, several consultations, you may see how many sets of data points you've got, for example, by filtering as such. And what you can do is you can go to the patient record on their main page and you can see exactly what's going on. So you can see here how we've graphed some data points over time, and you can see how, for example, the waist circumference is changing and how the body weight is changing as well. Naturally, you can apply this, as I said in the beginning, to all sorts of other values, whether it's BMI, blood pressure, both systolic and diastolic, and of course, things like height, weight. And you can also use such tools in Medesk to make growth charts as well, which may be very handy if you're dealing with children in particular. So I hope this has been helpful and given you a little bit of insight into how you can track your patient's progress in Medesk. We release new videos every week. Hit that subscribe button to learn how to grow your practice faster.